Hi, I'm Dr. Keller. I understand you're interested in wrinkles, so let's talk about wrinkles. There are 4 types of wrinkles. The first type of wrinkle are your expression, your character. Hi, I'm angry. Ooh, I'm sad. That is your character, and we don't want to get rid of those. That's what makes you you and unique. The second type of wrinkle are what we call surface wrinkles. And basically, if this is your skin, underneath the skin, you have collagen that's pushing up and making your skin flat. Over time, that collagen begins to denigrate, and what happens is it gets soft, if you will, and not as concentrated, so the skin falls down and forms fine wrinkles. That is what we call laser territory. Things like intense pulsed light, photorejuvenation, help build up that collagen which pushes up the skin and gives you a smooth look. The third kind of wrinkle are what we call dynamic wrinkles. And those are the wrinkles that are found here on the lateral canthi across the forehead. And those wrinkles are basically muscular wrinkles. And here's what I mean by that. If we take one of these wrinkles and look at it like this, what we have are big muscles that, like any muscles, when we use it over time, they get bigger and bigger and bigger, and they form a crevice or a valley. That's what you perceive as a wrinkle. But in reality, what it is it's muscles that have become large. Those are Botox territory, and that's where we use Botox. Now, how does Botox work? Well, we put Botox in here and in here, and what happens is those muscles can't move. Now, if I put a cast on this muscle and I couldn't move it, what would happen to that muscle? It would atrophy, you're right. So these muscles atrophy and the wrinkle gets softened, and that's how Botox works. But there's something else that's important you should realize. When these muscles are big like this and they contract, they're actually ripping the skin underneath. So you get 2 kinds of wrinkles from dynamic. You get the muscular wrinkles, but over time you get what's called the 4th kind of wrinkle, and those are static wrinkles. So we actually have wrinkles above and wrinkles below the surface, where the skin has actually been torn like a furrow. Those static wrinkles, you can tell because if you go like this where there's a wrinkle and it's still present, your skin has been torn. And that's where we use things like Juvederm, or we use Radius, or here's some Juvederm. And those are wrinkles that we fill. So again, there's 4 kinds of wrinkles. Wrinkles of expression, we don't want to touch those. Wrinkles where the skin below has become very weak and the collagen has disappeared. And those are fine wrinkles. The 3rd kind of wrinkle are dynamic wrinkles, where you're used to using those muscles a lot. And the 4th one is what we call static wrinkles, or permanent wrinkles. What should you be aware of with Botox? Well, what you need to remember is that Botox, even though it's a very potent a poison, if you will, it's also one of the safest things we use, and we've been using it for years. And believe it or not, it's very delicate. You can't shake it up, and it immediately takes effect. Now, a lot of my patients will say, well, if I stop using Botox, will my wrinkles be worse? No, they won't, because remember, when these muscles are contracting, it's tearing the skin underneath. So when we have the Botox present and these muscles aren't contracting, it gives that skin below a chance to heal, that collagen a chance to heal. So the answer to that is actually your wrinkles are less prominent if you should stop using Botox. What are some of the things that you need to remember? Well, after we inject the Botox, for the first day, you should work the wrinkles like this so that the Botox is driven into the neuromuscular junction. Then after the first day, the second day, you should leave it alone. What will happen is it takes about 4 days for the Botox to enter the neuromuscular junction. Then the muscles can't contract, and then the atrophy begins. So you see your best results in about 2 weeks. My patients wonder, well, how long will it last? And that, in large part, is due to how strong those muscles are and how active your metabolism is and your immune system. What I tell my patients, and the biggest mistake that they make, is they wait and see me when the wrinkle is deep, okay? And so I have to start all over again, you know, and atrophy the muscles. It's much better if you come and see me when they're just starting to get their power again. Well, how does that look? Well, if you look in the mirror and go, I wonder if I need more Botox, that's when you're at this stage. If you look in the mirror and go, oh, gee, I need more Botox, you're here. So come and see me at this stage, because here I can put the Botox in and we can keep those muscles atrophied. And think of it like this. If I were to leave this cast on for a year, those muscles wouldn't get as prominent. And we don't need these glabellar, frontalis, and lateral canthi muscles strong. In fact, in the old days, we used to cut them to get rid of those wrinkles. So I also want you to refer on my section under patient forums. Look and see about the release for Botox, and look and see what some of the adverse effects can be. But overall, Botox, believe it or not, is pretty safe, and we use it every day. Thanks.